For staying with us on Midday Kentucky. Well, February is American Heart Month, so who better to come in and talk about this than the experts? We have Jennifer with the American Heart Association and Allison, who is a nurse with St. Joseph's Hospital. Thank you both so much for being here.
Thanks for inviting us.
And you're wearing red. Red is obviously the heart color, correct?
Correct, the color of the month.
Yes, and we kick off February with Wear Red Day, don't we?
Correct, yes. Wear Red Day was Friday, February 1st, but people can wear red throughout the month of February to raise awareness about cardiovascular disease.
Why is it so important to have an entire month dedicated to educating people about keeping their heart healthy?
Well, you know, despite all of our efforts, cardiovascular disease is still the #1 killer of folks here in Kentucky and across the country. So it's really important that we continue to raise that awareness, continue to focus on the things that we can do to try to hopefully help folks have healthier, longer lives.
And heart disease does not discriminate between men, women, race, ethnicity. It affects everybody.
Correct.
What can we do to prevent? Now, well, let me ask you first, and this may be a question for you, Allison. Is heart disease more genetic, or is it a result of our daily habits?
A little bit of both, but our daily habits increase our risks also. So we ask people to get active. So a moderate activity weekly, about 150 minutes is good. Watch your diet. We want like a healthy, well-balanced diet, not a lot of sugar, not a lot of sodium. And also we ask everybody to check your numbers. Go to your primary physician. Make sure you know what your blood pressure is. Get a good blood pressure, be on medications if you need medications, know your cholesterol levels also.
So when you're talking numbers, we're talking blood pressure, cholesterol, anything else we need to check into?
Those are the main ones that we look at. And your primary doctor will run any other panels that he sees necessarily from your family history, because they'll go over that with you also.
Okay, now let's talk about symptoms and signs that maybe something may be going on with your heart that you're not wanting to happen.
Common ones: chest pain, arm that radiates down to your left arm, neck. It goes into your neck and your jaw. A lot of women have back pain also, nausea, lightheaded, dizziness. Those are the big key things.
Is it true that heart attack symptoms are different in men and women?
They can be. A lot of women have more back pain. Men have the chest pain. And not the nausea comes with a lot of women also.
Okay. Well, let's talk about the American Heart Association. You're very active in our community. What kind of things are you doing to keep people educated?
Well, we have a lot of activities throughout February and actually throughout the whole year to try to raise awareness, to try to educate. We also have a lot of advocacy efforts that take place. We've got a lobby day taking place here on Valentine's Day to try to encourage more heart-healthy legislation in the state. We have a lot of outreach events happening in February at some of the local churches through our Have Faith and Heart program, and just all sorts of things happening to try to reach different groups of folks and hopefully get them that information that they really need.
Sure, kick this awful disease in the heart, right?
Yeah.
Well, thank you both so much for being here. For more information on how to get these numbers checked, who to go to, any questions about heart disease, where should everybody go?
Our website is a great resource. It's heart.org.
Okay, so if you have any questions, check that out. And I'm sure they can always give you a call and come to St. Joseph's Hospital and get checked out as well. Thank you both so much for spreading the word. We want Kentucky to stay healthy. Thank you. Midday Kentucky. We'll be right back.